Welcome to Dental Cassettes. Today we will be talking about two factors in cavity preparation, that is, retention form and resistance form. Dangerous lesions, known as the carious lesions in dental terminology, develop when certain types of bacteria in the mouth digest carbohydrates to form acids, for instance, the bacteria called Streptococcus mutans. These invade the surface area of the teeth and gradually cause mineral depletion through the loss of calcium and phosphorus and the formation of carious lesions. When a cavity is prepared to remove the carious lesion, it is usually slightly larger than the size of the lesion itself. The cavity should have subtle features embedded in its structure to ensure a long life of the restoration. Two most important factors to consider are retention form and resistance form. The retention form represent the features that enable the cavity to be kept in place without movement. For example, if one were to think of a Class 1 pit as a box, where the base of the box or pulpal floor is slightly wider than its opening, there is almost no chance of the restoration getting dislodged. Resistance forms refer to the construction of a cavity that prevents the fracture of the restoration or the tooth itself. For example, amalgam is a brittle material, and if used with a thickness of less than 2 mm it may break under heavy loads. Therefore, the cavity prepared for the restoration of the amalgam should provide sufficient amplification of the amalgam in the occlusal area, at least 2 mm. Enamel is highly brittle, however, dentin, which is softer, acts as a cushion to support enamel and prevent its fracture. If an enamel margin was left unsupported during cavity preparation for amalgam, it may undergo fracture under forces of mastication.